syempre, ang ating doctor visitor today, si Dr. Sherry Koo. Ayan, sit down po tayo. Upo po tayo.
Hi, Doc!
Si Doc Sherry ay
Welcome sa bahay ni Kuya.
Good morning. Isa siyang pediatrician at consultant din siya. Graduate siya ng University of Santo Tomas College of Medicine and member of Philippine Pediatric Society. And ang pag-uusapan natin, oy, tamang-tama, meron tayong, wala na si baby George, wala na. About kids kasi yung pag-uusapan natin bilang pedya nga si ma'am. At ito ay deworming in children. We all know naman, di ba, yung mga worms talaga, it is one of the reasons why nagiging malnourished yung mga bata, di ba? So, just to have an overview po, no, Doc, ano po ang situation ng malnutrition sa ating bansa?
Well, medyo malaki. Around almost 30% are underweight. Meron din almost 20 to 30% are also stunted or yung medyo maliit. Tapos we have what we call an acute malnutrition, around almost 10% na rin po dito sa atin. So medyo malaki-laki rin po. There are different factors causing your malnutrition. Meron po kasing yung sitwasyon natin ngayon, yung taghirap natin, lalo na po sa mga on the lower class family. Tapos po yung kinakain din po kasi nila. That can also cause the malnutrition in kids.
Ang misconception kasi kapag malnourished ang bata, dapat payat or talagang sobrang butot balat na. Pero not necessarily, Doc, no? Pwedeng maging malaman yung bata, pero malnourished pa rin siya.
When you say kasi malnourished, it doesn't mean na kulang sa kinakain. But it's also the quality of the food that you take. So pwedeng mataba ang bata, pero kung kulang naman sa nutrition, like the vitamins or the micronutrients, yung minerals natin, pwedeng yun yung cause ng malnutrition naman nila.
Okay. But may two types of malnutrition ata dito, yung kwashiorkor at marasmus, di ba? Tama ba? Yung isa parang mas malaki yung tiyan niya, di ba?
Payat yung katawan, pero mataba.
Kaya nga sila natatawa sinasabi nila.
Hindi, valedictorian yan.
Kasi more importantly, Doc, gusto natin malaman, how do you diagnose someone kung siya ay malnourished, no? Aside from yung physical appearance niya.
Again, there are other causes kasi, di ba, you have yung quality based on, that's not the quality of the food that they take. Yeah, there are some, or the quantity. So usually pag quantity, yun nga makikita mo rin yung sa mga bata na parang ang payat ng katawan, payat ng extremities, pero malaki yung tiyan. Parang may tinatawag nating edematous. Oo. And then there are some na kahit mataba, cute naman sila, but they're also malnourished because of the quantity. Kasi they might have taken yung mga junk foods natin na kulang naman sa mga micronutrients. So when you say, it's hard, mahirap pong sabihin kung porket payat, malnourished din po sila.
Or kung payat, healthy na.
Yes. Pwedeng kahit mataba, hindi pa rin healthy. Doc, ano po ang mga risk factors of being malnourished?
Number one, if kasi pwedeng magsimula yan even inside the womb ng mother, lalo na po ang mommy, pag hindi ganun ka. Kulang sa prenatal care, bihira nagpapatingin, nagpapakonsulta, lalo na sa health center natin, it can start from there. So paglabas nila, ganun din tuloy-tuloy, hindi napapakain ng tama. Pwede po yung maliban sa pagiging payat, pwedeng hindi rin masyadong tumangkad. Even the school performance are also affected.
Yung mental ability nila, di ba? Kasi pag gutom ka, iba din ang naisip.
Sluggish po sila.
Galit daw.
Galit.
Pero Doc, di ba, but we can say the good thing about this is treatable.
Yeah.
We can manage this, we can correct this.
If it's a chronic malnutrition, usually we refer them to a gastroenterologist kasi dahan-dahan din po ang pag-build up, hindi rin po pwedeng biglaan. If we can control it from birth pa lang, better po yun. Pero at least they can improve sa school performance nila. So kaya the most common food that we can give, especially for less than 2, is breast milk. Yes, it's the best, yes.
Doc, now that napag-usapan nga natin yung malnutrition, we all know that, tulad ng sinabi ko kanina, worms is talaga one of the reasons kung bakit nagiging malnourished yung mga bata. Now, let's talk about yung mga human parasites. So, ano ba normally yung different types na namumuhay sa tiyan ng bata?
Maraming klaseng worms. Okay, dito sa atin, dito sa syudad, sa city, the most common are those what you call soil transmitted.
Pag nakapaa. Pag nakapaa,
Pag
diba?
napaka. Lalo na ho yung mga batang naglalaro sa lupa, if you have doon kasi nangingitlog yung mga worms So pag naglaro sila, hindi naghugas ng kamay, pwedeng doon nila susubo nila sa bibig. Then that can cause the transmission from the soil to
human
yes,
body.
Also, pwede rin po sa tubig. Pwede rin po sa mga gulay na hindi ho naluluto ng tama o ng mabuti. Pwede pong from there ang transmission.
Pero ito, common lang to sa kids or pwede rin ng adults na magkaroon nito?
Pwede rin po, pero mas common, mas prone sa bata. Oo, kasi as adults, we don't usually, hindi naman tayo nagpe-play, naglalaro.
Unless yun po yung work ng adult.
Yes.
My question is,
Yes, po.
even as adults, do you
Yes.
still have to deworm?
If you suspect, yes, better.
And how would you suspect?
Kasi when you have parasitic infection, the most common problem you have is what we call iron deficiency anemia because
Okay.
it eats up the blood.
Okay.
So baka maputla, lalo na under the eyes,
Yes.
the lips, di ba? But aside from suspecting na baka may parasitic infection, you have to also look for other causes kung bakit maputla po yung tao.
Dok, sa bata, ano ba normally manifestation? Sa meron siyang human parasites
Human
inside
parasite.
niya?
Again, sabi ko nga, hindi necessarily payat. Pwede kasing kahit yung matabang bata, meron ding worm infestation. So, pinaka-common is, again, yung pamumutla ng...
Pagmumutla.
Same,
Same.
namumutla.
Actually, same lang din naman. Pamumutla doon under the eyes, the lips, tapos yung iba medyo poor ang performance sa school, medyo parang mabagal gumalaw.
And I
Pero
think
tama ba yung doc sinasabi ng mga matatanda, di ba, na ano ba yan, ang takaw nito, kain ng kain, di tumataba. Siguro may bulati ka sa tiyan.
Maraming alaga.
May bulati ka sa tiyan.
dapat.
Ganun ba
Hindi
yun?
naman necessary.
Eh, si Rina may malakas kumain. Is there a chance po na meron siyang
Baka it's
bulati
just
sa katawan?
baka it's just the metabolism. Kaya kahit malakas kumain, mabilis. Yes.
Walang
oo.
alaga sa tiyan.
Oo. Tapos there is also a type of worm infestation na pag sa gabi po natutulog, parang medyo nangangati dun sa may
Yung,
puwet.
yung butt area.
So that's one type of parasite.
Dapat yatang mag-alaga ako niya para di ako tumabahin. Joke lang. Dok, paano ba ang tamang treatment once na ma-detect yung bata ay may ganito?
So, based on DOH and the Philippine Pediatric Society, actually, it's mandatory that we, as pediatrician, deworm the kids from at least from starting 1 year old to about 14 years of age. So there are two types of medicine actually. You have albendazole and you have mebendazole. Both of them works for the most common types of your worms that are infesting our kids dito sa Metro Manila. Tapos usually every 6 months, but just in case na pag nagbigay po tayo, then may lumabas po, you can repeat it at least after 2 or 3 weeks.
Doktora, question po. Kasi minsan dati nung nagmo-moonlight pa ako, no, may mga na-encounter, dinadala po itong mga pasyenteng ito. Masyadong erratic kasi yung worms. Minsan may lumalabas sa tenga, sa ilong. Any hole in the body po pwedeng lumabas, hindi po ba?
Yes.
Bakit po ganon? Mali ba yung pagbigay or wrong timing? Ano po yung nagiging problema? Bakit ganyan na sobrang erratic po itong mga worms na nag-infest dun sa pasyente?
Usually kasi they just stay in the gastrointestinal tract. Pero pag medyo madami, so they tend to travel. Oo, especially the worm, the white one, it's called the ascaris. Yes, it can go to the lungs. It can then come out from the ears or the nose. Even sometimes they vomit it out kasi medyo madami po talaga. So during those times, we give what we call an antihistamine before giving the deworming medicine. Yes.
Pero would you say, Doc, talaga that you recommend the parents to bring their children to the pediatrician for deworming at least once a year until
Yes.
14 years old?
Better. At least actually it's twice. Depends on the situation sa bahay and outside of the home. Better kasi para at least we can properly manage on the dose of the medicine. Oo, kasi syempre hindi rin naman pwedeng maging underdose or overdose in any medicine actually.
Yes.
Ito, last tips na lang po, Doc, dun sa ating mga mothers out there, no? Ano ba yung dapat gawin or ipaalala dun sa mga bata to prevent them from having these?
So, for the mothers, for the yayas, so you have to actually cook the food properly and make sure that the water is safe. Again, for the moms and the yayas, you have to ask your kids to wash your hands before and after using the toilet and after playing, before eating. Ganun po. Yun yung pinaka-safe and pinaka-least expensive tip that we can give to the mothers.
Ayun. Ang dami natin natutunan kay Doc, no? Thank you so much. Doc, saan po ba kayo pwedeng i-consult at hanapin ang ating mga kasambahay?
I have clinics at the...
Papadiworm ko kasi. Si Doc, hindi pa nakatingin sa akin.
So, I don't know. I have clinic at the Los Santos Medical Center. It's every Monday, Wednesday, and Friday, 4 to 6 in the afternoon at room 519.
Okay, thank you so much once again, Dr. Sherry Hu, at isa siyang pediatrician. Dami natin natutunan about deworming sa children. Thank you so much.